All right, welcome back to ABA exam review and the continuation of our BCBA practice exam series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like, subscribe, and share. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, please let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Gordon arrives at an intake assessment to discover his client is nonverbal and whose family only speaks Spanish at home. Gordon does not speak Spanish, and neither do his technicians. If Gordon wants to proceed ethically, what should he reasonably do? In order to maintain ethics, we have to consider cultural variables, our competence, and if we can reasonably practice and provide good service considering those factors. In this case, Gordon has a client who not only is nonverbal, but the client only speaks Spanish. Gordon doesn't speak Spanish, neither do his technicians. So what kind of situation is Gordon in? Well, Gordon now has to decide, can he reasonably provide what the client needs given these limitations? Just because Gordon doesn't speak Spanish and his technicians don't, it doesn't mean he can't take the client. He just needs to further evaluate what kind of service can he provide. So let's look at A. Explain that he cannot take the case since he cannot speak or teach Spanish. Now, that might be the case if the family needs that, right? If they need their analyst to speak and teach Spanish, sure, Gordon does not fit that requirement. But if they aren't concerned with that, Gordon might be able to serve the client. B, evaluate whether he can work within the family's needs linguistically and culturally. That's the key here. Gordon just has to figure out, and he has to self-assess and speak with the family, can I meet the client's needs? That is number one. C, search for and hire Spanish-speaking technicians. Is that reasonable? Maybe not, right? That's not an easy thing to do. And so just because Gordon gets a client that he does not necessarily fit culturally, it just isn't as easy as it sounds to go out and hire a technician who does. And then D, take the case, but focus solely on behaviors that Gordon can reasonably target and nothing else. Well, no, Gordon would be doing a disservice to the client in that case. He's not giving them the full scope of ABA. What Gordon needs to do is self-assess, speak with the family, and evaluate, can I work within your needs linguistically and culturally? A functional behavior assessment reveals a child's aggression is maintained by escape from non-preferred tasks and activity. The analyst during the assessment also notices signs of high anxiety in the client, but cannot reasonably measure this anxiety behaviorally. What should the analyst do? When we think about these internal functions, right, these private events, these private reflexes like anxiety, just because we can't reasonably measure the anxiety since it is private doesn't mean we can ignore it. It seems to be part of the behavior, or at least part of who the child is, given their aggression and given that the analyst clearly noticed signs of anxiety. They have to be able to do something besides ignoring the anxiety just because they can't measure it. So what should the analyst do? A, begin writing the treatment plan without considering the non-behavioral anxiety. You have to take it into consideration, right? It's part of who the client is, and you or a professional has to address it. B, ignore the anxiety signs and focus strictly on aggression. That would be doing a disservice to the client. Since the analyst noticed the anxiety, they have to attempt something, right? We can't pretend it isn't there. C, refer the client to a physician and have them evaluated for social anxiety disorder. Well, the analyst is not a diagnostician. It's not their responsibility to diagnose things. So C is going way too far on the other side. You can't say, well, I think they have social anxiety disorder. This analyst, that is not their role. D, recommend to the stakeholders a consultation from a professional regarding the anxiety. Yes, as the analyst, we recommend consultations when it calls for a consultation. If the analyst can't measure it, but they can measure the aggression, they still have to think about how we can assist our client with the anxiety. Best way to do that, given the answer choices, is recommend a consultation from a professional. Mr. Tim is teaching a student to button their coat. Mr. Tim will prompt the client physically, but only as necessary, while increasing the time before giving any prompts, allowing the student more time to respond independently. Which prompting strategy is being applied in this scenario? Let's think about the prompts. It is a prompting question. Mr. Tim is teaching a student to button the coat. He prompts the client physically, but only as necessary. So it seems like a graduated guidance type of prompting. And he increases the time before giving any prompts, meaning he's physically prompting as necessary, but starting to increase the time between the SD and the prompt. So what would that be considered? A, least to most prompting alone. Well, if we're starting with the graduated guidance, that's not necessarily going to be least to most because graduated guidance is very intrusive. B, errorless teaching with progressive time delay. It is not errorless teaching because he's using graduated guidance only as necessary physical prompting only as necessary, which isn't errorless. C, most to least prompting alone. It does appear to be most to least prompting, but he also has this situation where he's increasing time before giving any prompts. So what he's doing is this strategy of graduated guidance with a prompt delay. He is introducing physical prompts as necessary, right? But delaying the prompt more and more, giving the client an opportunity to respond independently. Frederick is deciding what suit he should wear to the event tonight. His partner holds up a suit and Frederick says yes or no. Any suit that gets a yes is put into a maybe pile to be further evaluated. What type of preference assessment does this most resemble? Preference assessment question, and pretty straightforward, right? With preference assessments, first question we ask, how many stimuli are we assessing? If it's one, it's probably single choice. If it's two, it's probably forced choice. Three or more, likely multiple stimulus. In this case, Frederick is deciding on a suit. His partner holds up a suit, and Frederick says yes or no. So how many stimuli is the partner assessing at any given time? Well, just one. One suit at a time. If the suit gets a yes, it's put into a pile. If it gets a no, we're not sure what happens. What we are concerned with, though, is how many stimuli is Frederick being assessed on at once? Just one. Each suit gets its own independent assessment, making this a single choice preference assessment. Simple question. When you get an easy question on your exam, don't overthink it. Trust your prep, answer it, and we move on. You're supervising two supervisees, one with extensive experience in applied behavior analysis, and another who is new to the field and requires more guidance. You notice the more experienced supervisee is advancing quickly, while the less experienced supervisee is struggling with the basics. You decide to provide the struggling supervisee with additional mentorship, varied training opportunities, and flexible feedback mechanisms. What key idea are you implementing? Long question, wordy question. Let's just stay patient and attack and understand what we're given. What do we know so far? You've got two supervisees, one with a lot of experience, one that needs more guidance. The experienced one is advancing quickly, less experienced one is struggling. So already, what should we be thinking? How do I best serve each individual? You're supposed to provide personalized supervision. So you give the struggling supervisee additional mentorship, training, and feedback. By doing that, what idea are you implementing? A, ensuring equity by differentiating your supervision based on individual needs. Yes, not everybody is going to have the same needs, be at the same level, and it's up to you as a good supervisor to meet in the middle and assist your supervisees based on those individual needs. Everything is personalized. B, promoting fairness by treating each supervisee the same and using the same program. That is not effective behavior management. It's not effective supervision. Everything needs to be individualized. C, evaluating each supervisee using the same standardized rating system. Well, that wouldn't be fair, right? One has extensive experience, one doesn't. One moves quicker, one doesn't. D, prioritizing the experienced supervisee in order to get your clients the best provider available. That's also not a good approach because both are going to be working with clients. Prioritizing the stronger one means neglecting the other one, and therefore neglecting the clients that they may be working with. What you're doing is ensuring equity by differentiating your supervision based on individual needs. Thanks for watching. Be sure to subscribe and like on YouTube. Also share. Check out behavioranalyststudy.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard, and see you soon.